I always get so nervous whenever surgeries are happening.
Every surgery is challenging in its own way, some more than others, but there is always risk involved. This hernia procedure is usually fairly straightforward, but as I'm getting in there, it's pretty clear that something isn't right. The cervix was stuck in this hole. It was complicating the surgery a little bit, but I got it out. Now we just have to close this hole in her belly. I'm gonna have Dr. Leach give me a hand during the suture process.
Oh, wow. Okay.
It's pretty big.
When we got in there, we discovered there was a very large hernia sac, but it was coming from the belly wall.
So there's our sac, and there's our external ring, and it does not, see that there's our femoral triangle down there.
Yeah.
So I think it was traumatic. I think there was a dog bite that opened it up.
So I suspect at some point in Shilo's previous life, she was bitten by a larger dog. Sometimes you get these dog bite injuries and there's no skin wound, but yet the tooth penetrates the muscle wall. And so you have a defect in the muscle wall and that creates a hernia, and now intestines, and we worry most about intestines, but your inside organs can get stuck in that hernia sac. When Dr. Stewart went into surgery, he found that part of the uterus and a loop of intestine had snaked down that little sac and gotten trapped in there. If that would have happened on the street, without care, Shilo would have died.
Thankfully, we got to it just in time, and with some help from Dr. Leach, we were able to get Shilo patched up and on the road to recovery.
Even if you don't see a wound on a dog bite in the abdomen, you should always explore it, because you can have a muscle tear that will lead to a hernia later on.
All right.